Hello, everybody. My name is Graham Elwood, and you are watching the Boom Political Vigilante. Great way to support the show, folks. You can see it right below is to become a member at patreon.com/Graham Elwood. One of the levels is the $5 submit an article, which this article was submitted by Tim Stack. Tim, dude, I got to thank you every month, man. You've been supporting us from the jump. We've been doing this show for 6 years now. For two of those 6 years. So a third of the life of this show has been demonetized by YouTube, which is where I would recommend you sign up and subscribe to Graham Elwood Clips. I'm just putting short clips of this show, of Government Secrets, and clips of my stand-up on. So we got to get that to 1,000. If we can get Graham Elwood Clips to 1,000 subscribers, then I can actually get that channel monetized and we can start getting paid for the ads, because there's ads playing in front of these videos and I don't get paid for them. Oh, isn't big tech great? Isn't it great? So we've talked about COVID on the show 2 years ago and a year and a half ago. Caused a big controversy because I was in favor of mandates. And that people were like, oh, Graham loves big pharma. Well, one of the things I was worried about was hospitalizations, and there's still 400 people dying every day because of COVID. So Tim sent this article about long COVID, and this is a legitimate concern. And this is why we should have kept mask mandates going in the United States, like they're still doing in Japan, many other Asian countries. Like Japan didn't really do a shutdown. You just wore a mask all the time outside, just kept masks on indoors. And that's what this article is saying. This is from WebMD. It was submitted by, and if you don't agree with this, whatever, man, you want to put a bunch of crazy comments or just yell and scream, that's fine. Long COVID experts. So incredibly clear what's at stake. Colin Furness has made it this far into the pandemic. This is as of October 18th without testing positive for the coronavirus. And he's working hard to keeping it that way. As an expert at the crossroads of infectious disease and organizational decision-making, Furness, PhD, an epidemiologist and assistant professor at the University of Toronto's Faculty of Information, is determined to do everything in his power to avoid infection and thus any long-term symptoms, including the syndrome known as long COVID. So to be clear here, guys, long COVID is not just some like, oh, it's an actual symptom that can affect people. And it's, and we're going to see, even if you're vaccinated, it can affect you. You're less likely to get long COVID or be hospitalized with the vaccine. But the handful, I follow a lot of people on Twitter and social media that are doctors and scientists and epidemiologists, and they've been saying we need to keep the mask thing. They've been very critical of the Biden administration for getting rid of the mask thing. And this is why. Long COVID, we don't even know the long-term effects of this. So we should still be treating it very cautiously. I did my yoga class this morning. There was me and one other person were the only people in yoga with masks on. Furness, an outspoken advocate for COVID-19 prevention, wears an N95 or N99 respirator mask when sharing air with others, including while delivering lectures. Excuse me. He uses carbon dioxide detector in class to monitor the ventilation. He's had 4 vaccine shots, 2 doses, and 2 boosters to date, and avoids public transportation by walking to work, a privilege he readily acknowledges not everyone has. He won't eat indoors at restaurants and meets his 10-year-old son for lunch outdoors, so his 5th grader never has to unmask at school. So this is one of the things, excuse me, I follow numerous people on Twitter that are like, we just got to keep wearing masks. Just keep wearing masks. I'm the only guy that wears, I'm the only guy wearing masks inside. I just did a comedy show Tuesday night and I had a mask on the entire time I was inside until I went on stage. I had to take my mask off, and that's a risk I'm taking as a performer. And then I try to put my mask back on as soon as the show's over and go outside, but I am taking a risk, and I know that. It's estimated that more than a third of people who have COVID-19 also have neurological complications such as brain fog that persist or develop 3 months after infection. That's pretty scary. And 2/3 of people with long COVID still have neurological symptoms after 6 months. At least some studies show. Experts and advocates say this must be considered in every step of the response to the pandemic, from public health and prevention to treatment, social assistance, and healthcare reform. COVID-19 can harm the brain in several ways. One of them is that leads the body to act abnormally, known as cell disegregation, if I'm saying that correctly, says from which often looks into coronavirus research on Twitter. The virus can have chaotic and unpredictable effects. It's like releasing a bunch of snakes in an office building. People start screaming and they stop working. So if your brain is an office building and employees are the brain cells, you release this, the virus, COVID-19, and people start screaming and running back and forth, and no one's dead, but no one's getting any work done. So recent data reveals long COVID is keeping 2 million to 4 million Americans out of work. And the virus is still killing nearly 400 people a day. Let's say that again. 2 to 4 million people are being kept out of work because they just can't, they have brain fog. And 400 people a day are still dying. 400 people a day are still dying. So all Biden had to do, he could have gotten rid of vaccine mandates. Okay. But just got to keep wearing a mask inside. You don't want to take this medication? That's fine. All right, fine. Don't take it. But we should have been keeping masks inside. When I'm on a plane, I'm usually, there's maybe 10, 15% of the plane is wearing masks. So this is, nobody wants to hear this. Amid mounting evidence that COVID-19 causes not only mild cognitive impairment, but is also linked to long-term conditions, including new onset Alzheimer's and Parkinson's degrees, Furness has been ramping up his message for more protective measures and care. For example, last month, he called on the government of Ontario, Canada's most populous province, to start building space for more dementia beds, as well as long-term care facilities that specialize in brain health for aging populations. But the coronavirus doesn't just affect thinking skills of just older people, and COVID-19 researchers still need to better define risk factors, regardless of age, says Joanna Helmuth, MD, a neurologist and researcher who specializes in post-viral cognitive conditions at the University of California, San Francisco. This is a real problem, but there's this additional layer of injustice that's happening because of cultural issues that cause us to stigmatize people with cognitive disorders, she says. If you're younger, there's that subtext like, this is psychosomatic. A lot of doctors push that narrative, and some patients don't even believe it themselves, so people are reluctant to seek care. And still, tools measuring long COVID cognitive symptoms are also lacking. Annie Benour, MD, a family doctor in Quebec, who has long COVID, Jesus, says even with her recent thinking problems, she aced one of the most widely used tests, a Montreal cognitive assessment, because it was designed for older people ages 55 to 85 with more advanced difficulties. Since getting COVID-19 while working in palliative care in December 2020, the 46-year-old says she is mentally impaired with brain fog and myalgic, I don't know what that is, also known as chronic fatigue syndrome, or ME/CFS, a common condition for long COVID patients. One of the many things she has lost, including the ability to speak without regular Botox injections into her damaged vocal cords, Jesus, is the ease with which she used to be able to do the most basic cognitive tasks, such as reading and writing. This is her posting online. Grateful to CC Complex Health, where I underwent plasmapheresis yesterday for neural long COVID. It was some of the best care I've received in 2 years of this debilitating illness. Also, they introduced me to chocolate tea, so now I'm hooked. Right? When she has ME CFF related crashes known as post-extrational malaise, even after minor physical and mental exertion, she says she becomes a dummy. She's been unable to work for 2 years. This is an MD. This is a highly educated woman who can't work. Treatments for long COVID and most brain conditions are still elusive. We definitely need more research. Jesus, you think so? I'm sorry. That's one of my biggest complaints with this whole process is there needs to just be more research. I mean, look, it's been 40 years of HIV and we still have no cure. There's better treatments. People can live with it way better. It's not a death sentence, but we need more research. We need to research the shit out of this. We need to research this. We need to get as much data. That's how science works. You have to get as much data as possible. You don't just listen to like one doctor that comes on your show and says it's a leaky vaccine. And then you go, oh, that's it. If a bunch of other doctors agree with that doctor, great. But we need as much research as possible. There's so many viruses I've read about, like HPV, the human papillomavirus. That can take 7 years before there's symptoms. I mean, HIV goes years before it becomes AIDS. Like it's again, more research. We need more research. The comprehensive list of treatments for long COVID is 0 drugs, none whatsoever. And in my view, this is a colossal failure. This Dr. Zaid Al-MD, a clinical epidemiologist and prolific long COVID researcher at Washington University in St. Louis. That's pretty. We also need vaccines that are designed to protect us not only from severe disease in the acute phase, but also against long COVID. Yeah, that's the thing. The vaccine's good about not getting it. And also, if you get it, you don't have severe reactions like having to be hospitalized or intubated or anything like that. But what about long COVID? I got to be honest with you, man. I'm just going to be honest with this audience. When I've had all my shots and boosters, and I'm the guy that's always wearing a mask, except when I stand on stage. And I don't even perform that often, but I got COVID in December, and I told this audience that. And I had like a, kind of a shitty flu for about 3-4 days and slowly start to feel better. And after about 8 or 9 days, I think I was able to do some light exercise. And after about 10 days, I, felt fine other than just sort of the congestion. And, but one of my fears is what happens if long COVID happens? Because if I lose my mental cognition, I can't do this. If I'm just walking around in a brain fog, unable to do anything, how am I going to work? So it's still out there, man. It's still a real thing. And I feel fine, and I'm paying very close attention to this. I mean, like, even before COVID ever came into existence, I had a grandmother who had Alzheimer's, and so I always, as I get older, even before COVID showed up, I'm like, I'm going to just pay attention to my mental cognition, and I'm eating as much like brain positive food as I can, and I'm super healthy to begin with, but you never know. In addition to funding and speeding up clinical treatment trials, government should be making other responses, says Hannah Davis, co-founder of the Patient-Led Research Collaborative and leader of long COVID advocacy during the pandemic, who has long COVID herself. Jesus Christ. In a testimony before House Select Subcommittee on the Coronavirus Crisis in July, the New York City-based artificial intelligence expert and co-author of several long COVID studies called for action right away, including paid leave to rest during the first couple of weeks of illness, unemployment and disability benefit reform, and other financial assistance to the millions of patients unable to support or care for themselves. I have a friend of mine. She got COVID before the vaccines were out in like December of 2020. And she's an attorney, and she couldn't work. She hasn't worked. I definitely see a need for an interim stage group home situation. There are people who are unable to function on their own, who are living on their own and need a lot of support. I think that's only going to keep growing. And yet one of the biggest gaps in addressing how long COVID is dealt with is that everyone's sense of risk is messed up right now. People who are getting long COVID now after being vaccinated and boosted or getting reinfected are really angry. Yeah, I can understand that. Recent survey data from the US Census Bureau and CDC shows that 30% of adults who ever had COVID symptoms, a federal government report published in March found that long COVID has potentially affected up to 23 million Americans. Acting on these mass numbers doesn't feel alarmist, said Davis. COVID-related brain fog symptoms are similar to the effects of concussion, says Andrew Ewing, PhD, a professor of chemistry and molecular biology at Sweden's University of Gothenburg, and a vocal advocate for COVID-19 prevention. Although it's not yet clear exactly how damage occurs or how brain cells are harmed, among the things he finds most unnerving about the condition is that every time someone has it, it's like getting repeated head trauma. Jesus. That's what we need to avoid, says Ewing, who believes that people should still be masking, social distancing, and isolating for longer periods after infection. That's what these foolish let it rip people are missing. For researchers, advocates, and observers who keep up with studies on COVID's neurological pathways and symptoms, remaining cautious is simply a no-brainer. If everyone were fully informed, I mean really fully informed, and they understood the way I did, need mask rules, said Furness. We wouldn't need them because it would just be so incredibly clear what's at stake. So there it is, folks. A bunch of researchers and scientists in that article are saying long COVID's a real thing. So I keep wearing my mask inside. When I have dinner and lunch with people, I try to find an outdoor place. I like sitting outdoors. And I don't try to like yell and get all rah, 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 but I just say, yeah, you might want to research some long COVID, because I've heard about this long COVID stuff, and I've read of some of the research. This research from this article is new to me. Some of these numbers were new to me, like 23 million Americans. But we need more information and more data, which is what all those researchers are saying. And several of those researchers have long COVID. So the effects of COVID, it's not over, man. The pandemic, like Joe Biden said, no, man, it's still here. And the long-term effects, we have no idea. And there needs to be more research on long COVID. Is there a vaccine for long COVID? Let's find one. Can we just find a flat out cure for COVID in general so nobody gets it anymore? Let's find that. Does that mean I love big pharmaceutical companies? No, I have this crazy notion that several things can exist at once, which is there's a lot about big pharma I don't trust. But to then say all medicines are bad is an insane leap in logic. I talked to a friend of mine who's a doctor that I grew up with. And he said, Graham, there's a lot of things big pharmaceutical companies do that I don't like, the price gouging and all this stuff. He goes, but I work on a daily basis with medicines that save people's lives. So that's crazy. So I just read you an article from WebMD with a bunch of researchers in it. Make your own decisions. I'm going to keep wearing my mask inside like I've been doing for 3 years. I'll wear it on a plane. And if you come to one of my shows, I really hope you wear a mask. I'm going to try to enforce a mask thing, but some of these clubs won't let me do it. Stay safe, everybody. And if you come down, if you test positive for it, stay home for over 10 days. So whatever, get the vaccine, don't get the vaccine. And I totally understand those concerns, but just wear a mask. It's not that hard. Just wear a mask. You put it on, you put it off. It's such an easy thing. You put it on, put it off. As soon as I get outside, take it off. I go inside and put it on. Go into the store, put it on. Make sure it fits right. Boom, do my shopping. I'm out. As soon as I walk outside, boom, take it off. It's not that hard. All right, everybody. Like, share, subscribe, support what we're doing. Shave your knuckles for justice. Boom. Hey, everybody. Thanks for watching. We are still in our ninth month of demonetization from YouTube. So support what we're doing at patreon.com/Graham Elwood or rockfin.com/Graham Elwood, which is a blockchain cryptocurrency platform. It's free to sign up, and there's a premium level at $10 a month. And for that, you get everybody on the platform's premium content. Myself, Lee Camp, Ron Placone, Jimmy Dore, Whitney Webb, Kim Iverson, Abby Martin, and many, many others. You can also support what we're doing at Venmo at Graham-Elwood and go to GrahamElwood.com. We have a PayPal button and a PO box. I also have crypto wallets, which are all in the show notes. Thanks for supporting what we do.